Hello, I'm Bersabe Tekle and you're watching ERi-TV. Welcome to English News Broadcast. Let us start with today's major headlines. One patient diagnosed positive for COVID-19 in test is carried out today. The Ministry of Health conducted an annual activity assessment meeting in Asmara. European Union dashes Ukraine's hopes of quick membership. And according to research, global COVID-19 deaths is estimated 3 times higher than what records say. On the local news, we have an announcement from the Ministry of Health. One patient has been diagnosed positive for COVID-19 and test is carried out today at testing station in the central region. On the other hand, 3 patients who have been receiving medical treatment in hospitals in the central region have recovered fully and have been discharged from these facilities. The total number of recovered patients has accordingly increased to 9,616, while the number of deaths stands at 103. The total number of confirmed cases in the country to date has increased to 9,720. Ministry of Health, Asmara, March 11, 2022. The Ministry of Health conducted an annual activity assessment meeting and discussed on the programs for 2022 from 9 to 10 March here in the capital. According to activity reports presented, HIV/AIDS infection rate that was about 4% in 23 has been declined to 0.22 in 2021, and malaria infection rate at national level has declined by over 29%. It was also reported that the number of pregnant women delivering in health facilities that was 42,000 in 2017 has increased to 52,639 in 2021. That is a 25% increase. Regarding voluntary blood donation, the report stated that about 10,000 units of blood was collected in 2021, and that 99.92% of the blood was collected from voluntary blood donors and the rest from members of families of patients. As part of the effort conducted to equip health facilities with modern medical equipment as well as ensuring supply of electricity, 19 ultrasounds and 9 X-ray machines as well as 62 solar power equipment has been distributed to health facilities all over the country, the report added. It was also reported that new oxygen producing plant has been installed in Halibut Hospital and new oxygen supply line and cylinder filling system in Villaggio Hospital. In a concluding speech, Ms. Amna Nur Hussein, Minister of Health, stating the activity reports presented provide adequate information on the strengths and weaknesses of health facilities all over the country, called for reinforcing efforts aimed at alleviating constraints being encountered, as well as to undertake cautious measures in the prevention of COVID-19 pandemic. The Ministry of Agriculture stated that the potato seeds that have been under experiment in lowland areas are bearing encouraging results. The ministry also indicated that experiment has been conducted on about 47 hectares of farmland in Gashbarka, northern Red Sea and southern Red Sea regions, and that about 109 exemplary farmers have participated at the project. Participant farmers in Gashbarka region explained to ERINA that they were skeptical at first as they were convinced that potatoes could not be cultivated in areas of hot climatic conditions, such as that of Gashbarka. However, after planting the potato seeds during the relatively cold season, they were able to cultivate encouraging harvest. Mr. Mulugeta Hagos, head of Vegetables and Fruits Development Unit at the Ministry of Agriculture, branch in Gashbarka region, on his part stated that potato seeds have been distributed to 90 farmers in the region and have been cultivated in about 40 hectares from November 2021 to March 2022, and that encouraging result has been registered. According to document, around 240 quintals of potatoes have been harvested from 1 hectare of farmland. Owing to the substantive investment in human capital and introduction of medical equipment it has acquired, Tesane Hospital is providing commendable health service. Mr. Dr. Gida Gabrawel, the medical director of the hospital, stated. In an interview conducted with ERINA, Dr. Gida indicated that in recent years, modern diagnostic and surgical equipment as well as dental equipment were introduced in hospital and that health services have been alleviated and the public has had access to effective and commendable service. He further stated that in 2021, outpatient health service has been provided to over 34,000 people, and 5,000 others were provided with inpatient service. Thanks to the effective awareness-raising campaigns conducted, the number of pregnant women delivering in health facilities has increased to 65%, and that effort is being exerted for better outcome, he added. Beneficiaries on their part attested to the fact that they are receiving commendable health service. Tesane Hospital provides health service to residents of Tesane, Golich, Haikota, and Fortosawa subzones. That was domestic news. Do stay with us for the international one after the short break. Welcome back. According to Reuters, yesterday, European Union leaders condemned the unspeakable suffering that Russia was inflicting on Ukraine. But at the summit in France, they refused Kiev's appeal for rapid accession to the bloc and deferred over the reach of sanctions against Moscow. The Russian invasion, the biggest assault on a European state since World War II, has affected Europe's security order and spurred European Union capitals into rethinking what the bloc should stand for, its economic defense and energy policies. The European Union was swift in imposing sweeping sanctions and offering political and humanitarian support to Ukraine, as well as some arms supplies, in the days after Russia attacked on February 24. However, cracks have appeared in the bloc's united front from its reaction to Kiev's demand for an accelerated membership of the wealthy club to how fast it can wean itself off Russia's fossil fuels and how best to shape an economic response. Joining the European Union is a process that usually takes years and requires meeting strict criteria from economic stability to rooting out corruption and respecting liberal human rights. The COVID-19 excess mortality team at the U.S. Washington University studied 191 countries and territories for what they call the true global death figure. The measure used is called excess deaths, or how many more people have been dying than would be expected compared to recent years before the pandemic hit. To calculate this, the researchers gathered data through searches of various government websites, the World Mortality Database, the Human Mortality Database, and the European Statistical Office. Rates of excess deaths are estimated to have varied dramatically by country and region, but the overall global rate calculated in the study was 122 deaths per 100,000 people. That would mean about 18.2 million deaths have happened because of COVID in the 2 years between the start of 2020 and the end of 2021, 3 times as many as the official 5.9 million that have actually been recorded. According to the research, the highest rates were in lower-income countries in Latin America, Europe, and Sub-Saharan Africa. But deaths were also fairly high in some high-income countries, such as Italy and parts of the U.S. The researchers predicted that excess mortality linked to the pandemic will decline thanks to vaccines and new treatments, but also warned that the pandemic is not yet over, and new and dangerous variants of the virus could emerge at any time. You're still watching ERi-TV, and now a recap of today's major headlines. One patient diagnosed positive for COVID-19 and test is carried out today. The Ministry of Health conducted an annual activity assessment meeting in Asmara. European Union dashes Ukraine's hopes of quick membership. And, according to researchers, global COVID-19 deaths is estimated 3 times higher than what records say. Dear viewers, that was it for today. Thanks for watching.